hand hygiene. I'm going to go see my first patient of the day. Hi, Miss Bush. Hi, I'm Virginia. I'm going to be your nurse today. How are you feeling? Congratulations, you had your baby. Do you mind if I look at your badge real quick? At your band? Can you state your full name and your date of birth for me? Okay, 1918. Okay, great. And I'm also going to check the band on your baby as well, okay? What's his name? Wow, Carl. How cute. Hi, Carl. Okay. State your name again for me. And if you can read the number off your band for me as well. Perfect. Matches up perfect. Congratulations. He's beautiful. So this is your first baby? Wow, how exciting. Well, I just got a few questions for you. I wanted to ask you a little bit about your delivery, and then I want to talk to you about some of your own care, if that's okay with you. So you had a vaginal delivery this morning at 2 a.m. Okay. Any problems with that delivery? So you had an episiotomy. Okay. So do you understand what that meant? That they cut you. That's what happened. And I don't see that you had any tears on your record, but I'm going to go ahead and check as well. Any problems with hemorrhoids? When I look, I want to make sure I'm going to look for that too. No problems with that. Okay, great. So what I'm going to do first is I'm going to go ahead and listen to your lungs, listen to your heart, I'm going to listen to all your internal organs, and then I'm going to ask you some questions also about how you're feeling, okay? So you're nice and awake and alert. I'm going to go ahead and listen to you. And I know that the nurse's aide already did your vital signs, and they all look good. So they were all at your pre-pregnancy values. So that was normal, okay? So I'm going to listen to your heart. Go ahead and breathe normally. Okay. Okay, sounds good. Now I'm going to go ahead and listen to your lungs. So just go ahead and take deep breaths, okay? Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, and then if you can turn over, I'm going to go ahead and do the back. Okay, you're nice and clear. Okay, great. What I want to check first is going to be your breasts. And then I've got a few questions for you about breastfeeding. So I know you indicated you want to breastfeed. Were you able to get your baby latched? Okay, so right after delivery. Great. Great. That's a good time to do it because the babies are more alert at that time, so that's nice. And did Carl latch okay? He did. Great. So if you don't mind, I'm just going to expose your breasts and I'm going to tell you what I'm looking for, okay? And then I'm going to give you some information about how to care for them. So I'm looking at Symmetry, okay? They both look symmetrical, and then I'm also going to feel, okay? What I'm feeling for is warmth or heat, and I'm feeling to see if they're tight and what we call engorgement, where they're overfull, they seem like they're overstretched, and they may be painful. So any tenderness? None. Okay. So they look like they're starting to fill. Have you tried to get any colostrum out? Okay. Well, I'm going to show you how to do that too. What I'm looking for with the nipples is that you're able to get them erect very easily, and that makes it easy for the baby to latch on. If the nipples were flat, or what we call inverted, where they kind of dip down, then we have to use some other measures to try to bring them out. Okay, but yours look like the baby will latch on very easily. Okay, the other thing I want to show you is how to get colostrum. So you take your thumb and your forefinger, and you're going to take it on the nipple, you're going to roll it back and roll it up. Okay, I want you to try it. Okay, see how you get colostrum? That works very well to help keep the nipples from drying out. And then also the babies can smell the odor of that, so when you bring him to breastfeed, he's going to smell that right away. The other thing is that it helps to nourish the nipple, so you can just rub that right in there, okay? I also want to talk to you about how to care for them. So my suggestion is when you're in the shower, you can let the nice warm water go over it, and then you want to let them air dry. As far as a bra, I would avoid underwires or anything that's too tight because it can affect the milk ducts under there, and you want to make sure that you have free flow. The other thing I want to talk to you about is making sure to empty the breasts. That helps to prevent what we call mastitis or milk stasis, and that's where the milk stays in there and we don't empty the breast completely. So each time you feed, you want to make sure to switch to the other side and start on the other side the next time. If you feel like the baby's not emptying you completely, you can always pump, and that can always help to empty the rest of the breast as well. Any questions on that? And then you want to feed the baby every 2 to 3 hours, and then on demand. So you kind of watch for it when he's giving you those cues of kind of looking like he wants to eat or sucking on his hand, okay? So make sure, look for those. And if he doesn't, you can wake him up, unwrap him, undress him, and then try to get him to latch. And if you need help, let us know. Okay, I'm going to go ahead, since we finished the breast assessment. Did you have any questions on the breast? Not now? Okay. Well, if you need help later on when the baby's awake and ready to latch, let us know and we'll come back in here and help you as well. Right now, I'm just going to look at your abdomen, okay? Since you had the epidural, which was your pain medication during labor, I always want to check, and I know we already looked at your back to make sure that that catheter was removed and the site looked fine, but sometimes those medications can slow everything down a little bit, so I want to make sure everything's working here okay. You denied that you had nausea or vomiting, okay, and you ate breakfast okay this morning after you delivered, so I'm just going to kind of look. You still have a little bit of a protruding abdomen, and that's totally normal after the delivery, so what I'm going to do is go ahead and listen. Make sure that your bowel sounds are active, okay? Sorry if it's a little cold, okay? Okay, your bowel sounds are nice and active, so no problems with that. That's great. Okay, so what I'm going to do on here at your abdomen, I'm going to ask you a little bit about how many times you've urinated, but before I get started with that, I'm going to go ahead and palpate or feel how your fundus or the top of that uterus is doing after you delivered. Yes, I know it's painful. Are you having any pain right now? What would you rate it? A 2? Okay. Would you like something for pain? Okay, well when you look at your perineum, I'm going to go ahead and look at those stitches and make sure that they look okay, and I can provide you with another ice pack the doctor ordered, okay? So what I'm going to do is I've got to hold this pressure here. I want to make sure that we don't push that uterus out when I actually feel for your fundus, okay? So there's going to be some pressure. I apologize. So after you deliver, it should be right around your umbilicus, or right at your belly button. So I'm going to start there and feel where I can feel it. Okay, and I do feel it. I know it's painful, I'm sorry. Putting lots of pressure here. And it's nice and firm. And we definitely want it to be firm because that tightens around those blood vessels or where the placenta, where baby was getting all his food when he was in your uterus. So now we got to make sure it stays nice and clamped down after we deliver. I'm going to pull this down just a little bit because when I massage, I also want to look at the bleeding, okay, or your lochia. Okay, and I do see some, and that's normal. It's rubra, and rubra is what it should be in the first few days, and it looks like it's small amount, so that's normal. I just want to tell you a little bit about it while we're here. Make sure you're changing your pads frequently. You want to make sure you rinse the area very well with a peri-bottle, and I'll show you that when we finish here with the assessment. If you ever feel more than a pad in an hour, you need to let us know. If you have big clots or if it has a strong odor or a foul odor, you need to let us know as well. It does have a little bit of an odor, but it shouldn't be something that smells foul, okay? Then once it goes from the rubra, it's going to change to serosa and alba. Okay, alba will be the very last little bit, and sometimes that can last up to a couple of weeks. Once it goes progressively to those other colors, it should never go backwards to the rubra or be heavier. It should always go from the moderate to light and should stay light throughout, okay? I don't know if the nurse had told you already, but nothing in the vagina, okay? So no tampons, no sex, or anything like that until the doctor clears you, okay? But do take very good care of the perineum, especially with that episiotomy. So while we're down here looking at that, I want to see the episiotomy, and I'm going to look from the front, okay? And then the best way to view the episiotomy is to have you turn on your side. So if I can have you turn on your side with this knee forward, okay? And I'm going to go ahead and look at that. And while I'm doing that, I'm also going to look for hemorrhoids. Okay, the episiotomy looks intact. The stitches don't look too tight. Okay. You have a little bit of swelling, which is normal, and I don't see any hemorrhoids at all. And I know you hadn't had any issues with that, so that looked normal, okay? So I'm going to go ahead and bring your pad back up. All right, any problems with that? So tell me a little bit about your urination. We want to make sure that you should be diuresing or getting rid of those extra fluids you had in pregnancy. So you'll probably be urinating a lot, pretty frequent. That's totally normal. How many times have we measured your urine after you delivered? Okay, 2 times. All right. So we're going to do one more. And you don't have the IV going anymore. If you did, I would also have checked that as well. If you had a C-section, of course, we would be looking at the abdomen for the incision or the sutures as well, but you don't have that. You have the perineum incision. Okay. Okay, so now I'm going to go ahead and check for swelling in your legs. I know you said you didn't have any problems during pregnancy. The other thing is that you're at high risk, of course, with pregnancy and after delivery for blood clots in the legs. So what I'm doing is I'm just kind of feeling to see if they feel warm. And they feel warm but not hot. I'm looking for any areas of swelling, and I don't see those either. So let me go ahead and feel pulses. Okay, you've got good strong pulses. And then your capillary refill looks very good. Do you have slippers with you or non-slip socks? We've got some non-slip socks for you as well. I want to make sure that you're wearing those so when you get out of bed that you don't slip. Okay? All right, I want to show you how to use your sitz bath. You said you hadn't used that yet, so I'm going to go ahead and open that up. And then the peri bottle they brought with you from labor and delivery, I'm not sure if you use that. I'm going to go ahead and put your rail up, okay? All right. And you've got your call bell. I'm going to make sure about that. So I'm going to demonstrate how to use your sitz bath, and I'm just going to talk a little bit about your peri bottle. Okay? I'm sure the other nurse in labor and delivery already talked to you about it, so I'm just going to kind of reiterate or mention about it again. Each time you go to the bathroom, when you urinate, and you still have that hat on the toilet, we're going to measure one more urine. I want you to fill this up with warm water. Okay? You can add a little bit of mild soap from the bathroom that we have in there, or you can just use warm water. Either one is okay. So the main thing with this is that you want to use that pressure. So once you fill it, you want to check how much you have in the bottle, because after you urinate, you want to be able to see how much urine was in there and how much was in the bottle. So you want to squeeze, and you want to go from front to back. Okay, that's going to help get rid of anything that's sitting on the perineum. Make sure to keep those stitches clean. And then as soon as you're finished, you want to make sure to pat dry. Okay, make sure not to strain when you go to the bathroom. Okay, we don't want you to do that because you have that episiotomy that's been closed and sutured. With those stitches, they're going to feel like they're drying and a little bit tight, but you don't want to strain with them. Okay, we want to make sure they stay nice and closed so that heals up great. Okay, and that's the peri bottle. So pat dry with the toilet paper instead of wiping, and that'll help to prevent any further injury to that area as well. So with your sitz bath being brand new, this is just for you. You're the only one that's going to have used it, and you're going to be able to take it home with you. So make sure not to forget it when you're discharged tomorrow, okay? So I'm just going to show you this setup from scratch. So you've got this complete tubing, and then you've also got the bag. So the first thing you'd want to do is to go ahead and you can fill your bag. What you want to do is fill it with warm water up to where the 2000 mark is. Make sure that the water hose is closed. You don't want it to all run out when you open it. This is going to hang right above the toilet, and then you can put about a third of the water here, and then you're going to make sure to set it up that way. Okay. When it overflows, because it will once I open this bag, you've got these little overflow openings here, and that's going to go right into the toilet because you're going to put it on the toilet just where it says front to front. And there's a little hole on the end of the tubing. Make sure that's facing up and that it's in the little hole in the middle there. Okay, that's going to give it the right angle. Then you're going to hang it up. When you go to sit down on the toilet, then you can go ahead and open up the clamp. When you open up the clamp, it's going to send the water circling, so it's going to be like a little whirlpool. It's going to help clean. It's going to help with the vascularity of it, so it's going to help with that, which aids in healing. It's going to help with that healing time, okay? And then it also can help with some discomfort as well. You might find that you like that. Okay, so use it about 15 minutes. It's going to cool off, and then you go ahead and empty it, wash it, and then you can do it again later on. Okay, like twice a day, unless the physician orders it more frequently. Okay, do you have any questions on that? Great. First time you use it, let us know, and we'll help you set it up. Okay? All right. Okay, so we finished your assessment. Do you have any questions on the findings that we had? Okay, great. I just wanted to talk to you a little bit about some safety items, okay? For one, when the nurse comes in, any nurse, and they're going to give you medication or anything, make sure that they're checking your bracelet, okay? And then same thing with baby. Anytime that you're going to walk in the hallway, you can take baby with you, of course. I want you to make sure the baby is in this bassinet here. All right, and that's just to ensure safety of the baby, but you can actually walk. Helps you to kind of walk a little more upright and give you some support too, and you can push the baby in the hallway. Now you'll notice that the baby had the monitor on their leg, so that's one of the safety mechanisms that we have. We want to make sure that doesn't fall off and that stays on at all times. Okay? Anybody that comes in to do anything with the baby, make sure also that they have the hospital ID and that's appropriate. If you feel like you want to go with them, if they're going to take the baby back to nursery, you can do that as well, to walk with them to make sure. Did they already show you how to use the bulb syringe? Okay, great. So make sure that you keep that with you at all times. Even when you go home, make sure that that's in the car seat right there where you can get at it. The other thing I wanted to mention was make sure baby's always on their back when they're sleeping, okay? That's the safest position for sleep. Make sure not to leave the baby on the bed and walk away. Okay, you need to be at the baby's side if you have them out of the crib. And the other thing I want to talk to you about is, I know after breastfeeding you can get kind of sleepy, and that's totally normal. But when you're getting tired, make sure to place the baby in the bassinet. We don't want you to fall asleep with the baby in the bed, okay? That increases their risks of rebreathing carbon dioxide, which isn't good for them, and they can end up having sudden infant death syndrome. Have you heard about that? Okay. I know that they talked to you about that when you delivered, but I just wanted to mention those things again for you, okay? Make sure you let us know when you're ready to breastfeed or when you're ready to get up and walk. I know you hadn't had a chance to shower. I want you to walk around a little bit before you shower because you can get a little bit lightheaded after delivery because of that fluctuation of the fluids, okay? So first time when you get up, please call us so we can walk with you. Okay, great. All right, any pain or any problems right now? Okay, can I get you anything? Great. And you got your call bell? Okay, good. I'm going to go ahead and write my name and number on the board so when you need something, you can get a hold of me. Okay. We'll see.